We are back here on Carolina Women. We are so excited about our dear next guest, Erin. She is a nurse. She's been an ICU nurse. She's worked in cardiology. You've got a really prestigious background, and you have a new business now. Share with us the name of your business and what you're doing. Let me give you a hint. It has to do with hormones. And we're excited.
It's relevant.
I do, yeah. So I'm really excited to bring you to the area. I'm Erin Gagne. I'm a nurse practitioner, and my business is called Revive Wellness. So we basically focus on hormone replacement therapy, integrated medicine, which is getting to the root cause of the problem, and anti-aging medicine.
So do you do kind of a combination allopathic and homeopathic kind of thing together?
I do. I believe there is a place for both, and so I do a blend depending on what's going on with the patient. So.
And I think today we wanted to focus on what hormone replacement therapy really looks like, because it's pretty broad spectrum these days.
Is it geared towards a certain age group? I mean, what time would people want to start focusing on that?
That's such a good question, because I don't think that hormones are discriminative of age. So really, what happens well, first let's talk about what hormones are. So they're chemical messengers in the body that send signals, and they say, hey, go do this, go sleep, go run, go, you know, allow us to do
stressed.
our functions. Yeah.
Right.
Hey, I'm stressed.
Love.
Don't sleep, right?
I'm in love.
But
Oxytocin.
they act as a symphony, and so everything has to be so perfect in the body, and when one is off, it's chaos. And as we age, men and women, they start to decline. And for women, this can be as early as your early 30s. So we typically go into menopause, the average age is around 52. Perimenopause symptoms happen 10 years earlier than that.
And what are the symptoms and things that people should look out for that might indicate that their hormones are whack?
What?
You're gonna know, yeah.
Well, we know with Debi, but.
So some of the first symptoms I see are actually related to testosterone dropping. That is actually the most dominant hormone we have, even though we always think about estrogen, and it starts to drop first. So in women, you're gonna see fatigue, weight gain, right? Inability to sleep, low libido. So all of those things are kind of the first things, and you'll start to get cycles that maybe are irregular. You're like, whoa, I haven't had a cycle in a while.
Right.
It's kind of a signal that something's off, and that's a great time to come in and get tested. For men, it's typically around that 40-year-old age that they start to see testosterone decreasing. They're tired, they're not gaining muscle, they have a lower than normal libido. So yeah, it's younger than you think.
Well, you said something that's really important, or I think would have impact to our viewers too. I just have to feel a little bit off. You're going to do the assessment. You're going to share what you would recommend that is appropriate for where we are hormonally.
And at Revive, what does that mean? Like a blood workup? What do we come and
probably
do?
A lot.
Yeah.
So it's going to be first up, your first visit is going to be more for me to gather information. I'm going to be a detective, and I'm going to ask a lot of personal questions. We're going to get to know each other real well. And then I'm going to order specific labs that I want to see. So it's going to be a comprehensive metabolic profile that looks at blood sugar, it looks at all your hormones, your thyroid, and your stress amounts. And then we come back in, and that's a longer visit for you. That's where we go through all the information. I educate you on hormones, the benefits, the risks, and then we decide what option is best for you.
And the mechanism by which you get the hormone is, I mean, there are a lot of different ways to receive the hormone,
That's
correct?
what we're learning today. So
Yeah,
what do you
share us a little
recommend?
So my favorite option, one of my favorites is a pellet. It looks like a little Tic Tac, and it's inserted underneath the skin in the hip area.
Yeah, in the hip.
And I love this option because it kind of works with your body's circadian rhythm. So if you're up and working out, it's going to release more. If you're sleeping, it's going to release less.
Got it.
And you set it and forget it. So you implant the pellet, and then for 3 to 4 months, depending if you're male or female, you don't have to think about it. But that's not for everyone. So we have.
And how often do you have to replace that?
So for men, it's typically about 4 months. For women, every 3 months.
Okay.
And then there's creams, there's troches, there's injectables, and there's oral for progesterone only. So it's what's right for the person, and we always have a conversation and let you decide.
I was just going to say
So
it, and I know
interesting.
we've only got about 30 seconds, but I think this has been is a fun show today because we're leaving you with like cliffhangers.
That's
Everyone's
right.
going to want to make sure they they tune in again to get the real scoop. But Erin, it's a pleasure. And if people want to come in for consultation or just to kind of get an idea of what you do, because you also, and I want to make sure we get it in before you leave.
She does the
you do
fun stuff.
injectables, you do all good
do
stuff.
the fun stuff
yes,
too.
We're all in.
I know. I do the fun stuff too. Yeah. So injectables, everything, whether you want Botox, filler, or hormones.
Okay.
You can contact my assistant. I'll leave you guys the number. That's the best way, and she'll get you scheduled. She is a joy to talk to, so she'll probably talk you into more things because it's just so fun to talk to her.
It's all about the upsell. Thank you for joining us. Stay with us. There's more to
Thank
come
you so
here on
much.
Carolina Women.